Welcome to MedEvidence, where we help you navigate the truth behind medical research with unbiased, evidence-proven facts. Hosted by cardiologist and top medical researcher, Dr. Michael Koren.
Hello, I'm Dr. Michael Koren, the executive editor of MedEvidence. And I have a really fun job today. I'm really excited about this part of my job, which is to interview my former classmate and a real leader in medicine, Dr. Michael Myers. Mike, thank you for being part of our family here at
Mike.
MedEvidence.
Thanks for having me on.
Yeah. So Mike and I caught up recently at our reunion, our medical school reunion. We won't tell you how many years it was because we want to protect the innocent here. But we had a fascinating conversation, and it reminded me of a few things about Mike that I really want to share with our audience. Mike was a true leader at Harvard Medical School. And you can imagine the kind of students. We probably had about 165 people in our class. And quite frankly, a few prima donnas amongst us maybe. But Mike really popped as a leader amongst leaders. And I'm fascinated to talk a little bit about him and what got him to that point, and then for him to share his really interesting and unique career path that led to a major role in administrative medicine. So Mike, welcome to MedEvidence, and let's start telling your story. Like, where'd you grow up? How'd you become such a leader at Harvard, and how'd you get to be where you are now?
So I grew up in America. I have literally lived everywhere from Los Angeles now up to Vermont. I was born in Kansas City. And then right when I was a baby, my mom and my dad were 17 and 18 when I was born. But my father was the youngest of four, and his eldest sister, my Aunt Stacy, was married to a surgeon in LA. And my dad wanted to finish his education. And at that time, California provided tuition-free college education. So he moved his whole family to Los Angeles when I was a little baby. I was born in 1959. So I lived...
You let the cat out of the bag.
Sorry, okay. So I grew up in LA. We stayed there until about 1971. And then we moved back to Kansas City, where I went to sixth grade, junior high, high school. And then from there, I just started moving east. I went to college in Baltimore, Johns Hopkins, Harvard Medical School, had my whole career in the Boston area, got an MBA. So that's kind of where I am. I'm a citizen of the US of A, to be honest. Yeah.
I love it. I love it. And tell us a little bit about your medical training. What was your specialty and how you got into administrative medicine?
So I need to give complete credit to one of my mentors, Dr. Ronald Arkey, who ran the Peabody group when a society when we were at Harvard. Yeah. He was my internship advisor. And at the time we had to sort of choose specialties. I thought I was going to be a dermatologist, and I had done all kind of research in derm at MGH. And I'm going to say this because I literally believe.
And MGH is Mass General Hospital.
Now
for
it's
people.
Now it's known as MGB, Mass General Brigham, to really highlight the prominence of Mass General over everybody else, right? So man's greatest hospital, as we all remember from the House of God. So anyway, I was on my bicycle, leaving my research lab, riding to Somerville, and I literally heard a voice. And this is what the voice said to me. The voice said, "Zits." That was what the voice said. "Zits." And it was literally an audible voice. And so I said, oh my God, God's right. Like, I have invested all of this time and effort in developing you. You got the best education in the solar system, and you're going to throw it away to be a dermatologist? This is really serious, Mike. Okay, I'm really serious.
Okay. Well, again, apologies to our dermatology colleagues who I love and do really good work, but I hear you.
So I went to my internship. The whole thing was set in motion. I went to Dr. Arkey. I said, Dr. Arkey, I can't be a dermatologist. I said, I heard from God. He spoke to me from on high. He put his, I don't know if you know Ron Arkey, but he's a very unassuming,
he's terrific. Oh my God.
Guy. He's kind of a big teddy bear. He kind of put his arm around me. He said, Mike, you belong at Mount Auburn Hospital. as a primary care doctor. That's where you belong. And so that's how I ended up at Mount Auburn in primary care. And then the rest is history from that point. Yeah.
Wow. Yeah. Yeah, Ron was such a
Yeah.
fabulous guy. I was having a conversation with him. I had a similar conversation with him when I was trying to decide between medicine and
Oh, wow.
surgery, and yeah, so that was kind of my decision point. But so keep on going. So you ended up doing family medicine,
So
or
it
what was
was,
your actual residency?
internal medicine. To be honest, back then, and Harvard in the mid 80s was not a place that encouraged people to pursue family medicine or primary care medicine, very research oriented. And I was kind of out there with my interest in, those areas of work. And so went to Mount Auburn. I've had pretty much a straight shot through the whole process from kindergarten. So straight from grade school to junior high, high to college, college med, and then from medical school to internship residency. So I was at Mount Auburn between 1985 and 1988. And then from that point, because I had come from a family of doctors and dentists in Kansas City, Los Angeles, and Texas, the family, I guess you would call it the family model, was kind of hanging your shingle up and having your own practice. So I did that. I decided to pursue that in Dorchester, Massachusetts, where I had my first private practice.
Okay, interesting, interesting. So as I mentioned, you were certainly a leader in our class. So if you survey the members of our class and say, who are the five leaders, your name would come up for everybody. So what was it about that upbringing that led you to be a leader at Harvard Medical School?
Well, probably gift of gab, a real drive toward excellence, and I just generally like people. It sounds a little corny. Um,
Right.
and sometimes it isn't so much that you choose a leadership position, but it sort of chooses you. I mean, the vacuum created by people having not just good ideas, but ideas that are actionable and people that are willing to step in and to carry out those ideas is a fairly small numerator. So I've always been a person interested in solving problems, not necessarily complaining about things. I move very quickly through Kubler-Ross stages, right? I don't stay in anger, depression, or bargaining. I get to acceptance and problem solving. That is really what a leader is called to do and paid to do, not to kvetch and complain, but really to solve problems. And we have a lot of big ones, and they won't go away. And so that's kind of where I grew up and came in, and the kind of work I've done throughout my career.
So interesting. So interesting. So let's
Mm,
fast forward. You were in private practice for a while, but you ended up having a good portion of your career in administrative
yes.
medicine. So how'd that happen?
So, okay. So I am following the family model, shingle out in Dorchester, thinking I'm just going to be a basic family doc. This is the mid 80s, late 80s in Boston and Massachusetts, not realizing that the world around me was changing. It was more about managed care, population health medicine. All of these things were going on, and I am literally struggling to hold on to what amounts to be an inner city practice, in the outskirts of the Boston area. And I just found it to be impossible to carry out. I was basically at one point working three different jobs to not only pay back student loans, but to support my very young family, and then also to pay the overhead of my practice. This is tell one little tiny story from that moment. So my son at that point was just a little kid, and I remember I would have this kind of existence where I would work my day job, have on my scrubs, come home for dinner, change, and then go to the ER or do rounds at the nursing home because I had my private practice, nursing home directorship, and I would do moonlighting at Kearney Hospital. And Trey would never meet me. Trey would never meet me at the door, and he was literally waiting there. It was snot coming down his nose and kind of looking at me. And he said to me, He was a little boy. I still remember this. It breaks my heart. He said, "Daddy, Daddy, are you a real doctor?" I said, "Yeah, I'm a real doctor." So he goes, "Because I need a real doctor." And I looked down at him, and he was basically in the throes of having an asthma attack. I took I took him to his pediatrician. He had to be admitted to Children's Hospital and put on IV. So that kind of illustrates how busy I was. I was not even observant enough to see that my kid was so sick that he needed to action. So he's like, "Are you a real doctor? Because I have to go see a real doctor." So things were, yeah, go ahead.
Well,
I'm sorry.
you got him to where he needed to go. So you were actually both a dad and a
Yeah.
real doctor from my
Yes. It's kind
perspective.
of
Just to
hard
throw
to
that out
balance
there.
that
Yeah.
kind of work life thing. But anyway, I tried to pursue this and, did my best. Anyway, then what happened is somehow I got into the Rolodex of the media. And I think my byline was, again, something I don't think you realize, but I'll now tell the story. Brilliant African American Harvard doctor fails miserably in private practice. That was kind of like my byline. So I was on 60 Minutes. I was on 2020. I was on the cover of the Boston Globe magazine, right, in about 1988, 1989. That brought me to the attention of people at MIT in their medical department at College Health Service. Arnie Weinberg, who I knew, called me up from my days at Mount Auburn Hospital. He said, "Mike, you look miserable on the cover of the Globe. Come work for us. Come work for us. We'll make you happy."
Wow.
So that's literally
Wow.
how I went from, closing down my private practice over to MIT. And, Mike, before we take a bit of a pause, that has really been the the trajectory of my career. It has been total serendipity. It has never been like me trying to make things work. It's like opportunities kind of come my way and then they come at the right moment and I just go for it. So that's how I got my job at MIT, which was my last clinical job. And from there, I kind of turned my ship.
But preparation meets
Well,
opportunity. So you were prepared.
that's one of my favorite quotes, and it's inside Vanderbilt Hall in the Dome. It's the quote by Louis Pasteur: "Chance favors the prepared mind."
There
Yes.
you go. Exactly. I love
Yeah.
that quote. Yes. Yep. Absolutely. So then you went to MIT, I guess, to learn some management skills, whatever happened there, and then you ended up in New Jersey, as I understand it, very involved in running a
Yeah.
doctors group, if I'm
Yep.
not mistaken.
So 11 different jobs. I won't go through all of them. Between residency, MIT was my last position. I got a call out of the blue from a headhunter indicating I would be the perfect candidate for a job at Blue Cross Blue Shield. And that's when I turned my ship. So I became the associate medical director for government programs at Blue Cross, which meant that I helped to provide medical policy insight for Medicare and Medicaid in this region. From Blue Cross, they actually paid for me to get an MBA. And then as I was getting my MBA, laid me off, right? That was my first layoff. So
Oh,
laid me off, Blue Cross, my brilliant career. And I got this great idea to start my own business, my own healthcare consulting business. Um, and I then started my own business or had this business idea, shopped it around to some people that I knew at Coopers and Lybrand, ended up being hired there to run a new division they were starting. Then Coopers merged with PricewaterhouseCoopers. I was there for a bit. They laid me off. Started my own company, then more healthcare consulting. And then I ended up at Partners Healthcare, working for MGB and the Brigham, et cetera. And basically kind of ran medical groups as a medical director, from Partners to Hawthorne Medical Associates, Compass, and then down in New Jersey at Summit Health. So that's kind of like the trajectory of my brilliant career in medicine, such as it was.
so did you learn things from medical school dealing with the prima donnas in our class that helped you run these huge medical practices?
So yeah, because there's a lot of big egos that you have to manage. And you know what motivates doctors, right? Because all of us are sort of grade grubbing pre-meds. We all think we're making A's in the class when really are not. And I think it's also learning how to motivate people by understanding what makes them tick. So that kind of knowledge I was marinated in at Harvard, and then it's kind of continued to cultivate and germinate as I, continued on. And I think that's kind of what made me effective is that, managing positions is very hard, right? Because they they are extraordinarily hardworking, intelligent, ethical, very high standards. I'm going to say this. They also like money. Okay. So I know I'm not
Mhm.
supposed to say
Sure.
that, but it is true.
Who
Right.
doesn't? No,
You
that's
know,
okay.
and
Yeah.
this is American medicine, right? So this is what it's all about. And so finding ways to thread that needle sometimes to actually influence, impact their behavior is it's not easy, but I had a finesse and ability to do that. So that's what made me, I think, effective in what I did in my career.
Yeah, I love that. I love that. So I'm going to transition a little bit here because I know the other thing that you're very passionate about is communicating to the
Yes.
public. In fact, you have a book that you've published related to the COVID-19 pandemic, and you can show us that in a second. But that's certainly been something that I know excites you, that you're passionate about, that you've published, and you plan on publishing further in the future. So tell us a little bit how you got interested in that and how you got to the point where you became an
So,
author.
like a lot of us, all of us sort of literally caught by surprise in March of 2020. All of us in medicine have our own unique stories, but people like me in medical leadership had to turn on a dime and become infectious disease specialists, epidemiologists, public health professionals to sort of understand how to lead our practice groups through this new pandemic. So I literally found myself becoming all those things, right? I had to learn about infectious diseases. I had to learn about epidemiology, things about public health. And literally, as you remember, the news about COVID was changing almost hour by hour, day by day, week by week, until even when we had a vaccine that was developed in 11 months, there was still a lot going on. And then we had the variants. And so I found myself at here's what really happened. A, a college that was, Judy Salerno, our classmate, is on their board, Stonehill College in Easton, Massachusetts, contacted me about being a scientific consultant to their COVID-19 program because they were trying, like a lot of colleges, to keep students in school and keep workers and students safe. So I was a scientific advisor to that effort for a while. And I really loved being in the college environment. And so from there, became very close friends with the president and the chief of staff. And I approached them and said, hey, listen, this COVID thing's going to be over pretty soon. You guys are going to fire me, but I really like Stonehill, and I have an idea for a course I'd like to teach or a book I'd like to write. And that's how I basically developed. I taught two courses there. What was a general course on the American healthcare system, and the other was basically a seminar for a senior health science majors, which became my textbook, COVIDology, a field guide. So I used the seminar to dress rehearse various ideas. And I didn't even have an editor. I just wrote a book proposal and I submitted it to the acquisition editors of the three biggest publishers of STEM textbooks. Two of them ghosted me. One of them responded within 4 hours. I want to give him credit. Chuck Crumley, CRC Press, Taylor and Francis Group. He got back to me within 4 hours, literally, of submitting my book proposal. He goes, Dr. Mike, this is a great idea. We would love to work with you. Let's go for it. And we did. And I literally wrote that book in 4 months on the road because we traveled. We took a cross country trip from Boston to Palm Springs, my husband and I, and our little dog, because we thought we were going to retire in Palm Springs. And I wrote COVIDology over that 4 month period when I
Wow.
was out in California.
So
Yeah.
cool.
Yeah.
Super cool. Show the book.
Oh,
I know
yeah,
you
here it
have it by
is.
you. Yeah.
There you go.
You
With
should
the
be very
SARS,
you should be very
the
proud of it.
SARS-CoV-2
Very
virus.
cool.
Yes. Little
Very cool
spike
cover with the
glycoprotein.
prominent spike
Spike protein up
proteins.
there, right. Like little nutmegs, sitting up there.
Yeah,
Yeah.
I
Right.
love it. Yeah, so show one more time so the audience can get a
There
good
you
look.
go.
All
At a
right. Beautiful.
Amazon near you, if you use Amazon.
That
All
sounds
right.
great. Well, I haven't read it yet, but it's now on my list of things to
Excellent.
read. So thank you for sharing that. And I know that you're looking at another
Yes.
book as we speak. So I know that that's still in the formative phases, but tell us a little bit
So the
about it.
book's title is The Vaccine Bible: From Anthrax to Zika, Nature's Most Destructive Germs and the Science That Keeps Us Safe. And I don't have to remind anyone that right now we are in the throes of a watershed moment in our country's culture where leaders who are in charge of federal health policy around vaccines or science or a number of things are frankly anti-science, pseudoscience, anti-vax. I'm not going to name names, but I think that there is going to be a great hue and cry and need for what I call the Fanny Farmer cookbook of vaccines. That people just want basic, objective. And listen, you can have an opinion about anything, but have an informed opinion based upon actual facts. 2 + 2 is 4. There is a law of gravity. There is germ theory. Bacteria and viruses and fungi and parasites exist. These things
And
are
cause disease.
settled.
Yes.
There is no question about any of this stuff. I don't know how I've ended up in this space, but I have ended up as a huge proponent for this great technology that is historically responsible for saving millions of people's lives. Just to say one thing, back in the late 50s, we celebrated Jonas Salk for discovering the polio vaccine. There was a ticker tape parade. I mean, people worldwide, lauded this. Where has that feeling gone? Where is that feeling? And so I'm hoping that through the Vaccine Bible to add to in that space. I'm not political. This is not a polemic. I'm not arguing with people. I want to give people who are even vaccine skeptic, but science curious, information that will help them have a intelligent conversation with their friends and family, their daughters and grandchildren, and their physicians about vaccine decisions that they're going to have to make for themselves or for their families. That's what the Vaccine Bible is.
Yeah, I love that. I love that. And you used a word in your description of this passion of yours, which is culture.
Yes.
And I think the culture of scientific curiosity, let's use that word, or wanting to understand things from a scientific point of view was different in the 1950s compared to the way it is today.
Absolutely.
And I think that both of us have a passion around getting back to the culture of scientific curiosity and helping people understand that we have scientific questions and we have ways of answering those scientific questions. And although we don't know everything, there's certain things we definitely know well. There's certain things we definitely don't know. And of course, there's a process to figure out the stuff that we don't know. And to that point, you and I were just talking about something. We kind of crossed paths in an interesting way. So you told me how you got into this public health space. And for me, as a practicing cardiologist that ran a lot of clinical trials, I was called into service when COVID-19 hit because I knew how to run clinical trials. So here I am in Northeast Florida with a large clinical trial group, and we needed to test these vaccines for a couple of reasons. One is all of our other studies went away. They were put on hold by the government and the sponsors because of concern about the contagion of COVID-19. And two, of course, with Project Warp Speed, there was so much focus on getting these products to the market as quickly as possible. And I got to participate in that, and just like you, learned a lot more about virology and epidemiology and other things than I would ever imagine as a cardiologist. But it was a fascinating learn. And as part of what I had to do, I had to reach out to our local community and get people comfortable with the idea of being in a clinical trial that used messenger RNA vaccines. And so it was a fascinating experience for me. And one of the things I learned early on in this experience was that there was a cross-cultural connection between African and Middle Eastern culture and European culture. And that happened in the melting pot of the Massachusetts Bay Colony in Boston. And so it was an interesting story about somebody named Onesimus, who is the slave of Cotton Mather back in the early 1700s. And I learned this actually from an African-American person at one of my conferences. I had never heard of Onesimus at that time, and then did the research to learn about it. But it's fascinating. Onesimus was inoculated in Africa, came to the colonies as a teenager or as a older boy, and then eventually became a slave to Cotton Mather, who named him Onesimus, by the way, because that's actually the name of a slave in the Bible. It's in the New Testament when a Caucasian slave named Onesimus ran away from his owner, who was actually an early Christian bishop. And the Apostle Paul was responsible for trying to connect reconciliation between this slave owner and this bishop. So that's an aside, but that's what the name means. It actually means useful or beneficial in Greek. And so he wasn't using his African name, he was using this name that Cotton Mather came up with. But the thing that's most important for history is that the two of them collaborated on an early clinical trial in 1721 when smallpox came to Boston from the UK. And everybody knew it was going to come because the sailors are coming back and forth, and eventually they're going to bring it. And sure enough, this epidemic of smallpox hit Boston. Back in those days, literally, Mike, a third of the population could be wiped out by smallpox. And Onesimus and Cotton Mather got together. They inoculated about 200 or so people. And the people who were inoculated only had a 2% mortality rate versus a 16% mortality rate amongst the general population of Boston during this pandemic. So it was a really good early example of, one, a scientific experiment that showed a difference, two, this cross-cultural cooperation, a concept that really developed in Africa being now used by Europeans, and three, reporting the results, which is such a key part. If you do things and you just kind of learn from your own experience, that's one thing, but then reporting the results to the general public and to other medical professionals is a really important piece of this sharing of knowledge. And certainly you're pulling from that tradition by doing what you're doing with your vaccine Bible. So again, we're super proud of you and thank you for the work. And we can't wait to see it.
Let me tease out a couple of things from that story, which I also find fascinating. So this clinical trial was run, as you know, at a time before formal germ theory was even understood. We didn't really understand how these diseases were transmitted or what they were caused by, right? People were still believing in the humors and, bloodletting and other things as a means to actually cure diseases and ailments, right? And so that's kind of amazing itself. I think the other thing this illustrates too is the meaning of meritocracy. It doesn't matter that the originator of this idea was a Black man or Black people. Practically, it worked. He is showing how it's saving people's lives. It doesn't matter that it was a Black person that did that. If there's a benefit that we can derive from it, bring it on, right? And to me, that is what, any culture or any nation should really relish and celebrate, is the ideas that we're able to share that benefit all, irrespective of their source or where they came from, right? And unfortunately, we are a long way today from that. And it's a sad commentary. Right. I don't know if you have followed Robert Reich. He has a new memoir called Coming Up Short. And he basically apologizes on behalf of our baby boom generation. He was born in 1946, for not leaving a better world and actually creating the kind of meritocracy that they were hopeful around developing. And because there's a lot going on, and I don't want to name names or talk about people, but we're a long way from that at this particular point, sadly. Yeah.
Sure. Yeah. Yeah. And I'm not sure, I wouldn't completely agree that there is a complete lack of meritocracy, but to your point, I think that we can do a better job. But I think the way we all do a better job is by just sharing these important stories, including the Onesimus Cotton Mather story, where people from very different cultures work together to
and the history is important. It's important to understand the sources and the stories, good, bad, and indifferent, right? This is part of history.
Absolutely.
Yeah. Right.
Absolutely. So to me, that's fascinating. And also, let's not forget the learning of the past, I think, is another important message. I think sometimes that has occurred, and it's really valuable to remind ourselves of that. So again, we're looking forward to seeing your book come out, and it sounds like it's going to be a nice primer that will help people understand all these things. By the way, this comes up all the time. I was at a family event recently, And we have a new baby in our family, and the parents of the baby were asking me as a medical professional, not that I'm a particular expert in pediatrics, of course, but I know a little bit about vaccines now. And they were concerned. These are very educated people, and they were concerned whether or not it was safe to give multiple vaccines to their young infant all at the same time. They said, wouldn't it make sense if you spread it out more? And I think that was a legitimate question, one that I'm really not qualified to answer at all. But the point being here is that there's been a lot of now questions about vaccines, which are fair and legitimate, but giving the vaccines are not in question. All these things are safe and effective, and whether or not we can do better at our distribution process or the timing of these vaccines is something that we're certainly interested in research, but that doesn't take away from the fact that vaccines save lives.
That's completely true. And to directly answer that concern, it is not only safe and effective, but it's also a little more economical to give certain vaccines together in a combination according to the immunization schedules that have been established by the Centers for Disease Control and Prevention. Just to say one thing, early June this year, a very important committee called the Advisory Committee for Immunization Practices, the ACIP, was disbanded by the Secretary for Health and Human Services and reconstituted. ACIP has an extremely important role in examining the medical and scientific evidence about vaccine use and applicability to the American public, and then advises the CDC director around recommendations for how those vaccines should be used. They study meticulously all of the available science and evidence at the time the vaccine is going to be reviewed. And so when they make a recommendation, one of the things that people should realize is that vaccine guidance has been vetted to the extreme extent. Everything has been looked at. And they'll tell you, you can actually go onto their website and you can look at the evidence for yourself. You can look at all the studies, read through all the outcomes and all the concerns, and look at their recommendations. And so when you look at the immunization schedule that your family members are following, that schedule is based upon these recommendations, which are based upon science and vetted by these important policymaking groups like ACIP and CDC.
Well, thanks for sharing that. And yeah, we are in a bit of uncharted waters in terms of how a non-physician autocrat, I'll use that word to be polite, is maybe influencing things that should be scientifically based. And that's about as political as I'm going to get right now.
Yeah, I hear you. I hear you.
Yeah. But anyhow, Mike, this has been a delightful conversation. A lot of fun for me. I learned a lot.
Mike,
we'll definitely bring you back.
I am honored, and I really mean that you asked me to be part of this conversation and that we were able to reconnect this past June at our HMS class reunion. There will be more. I will be there, as I always am.
Sure.
So this has been a delight for me and a real honor.
Yeah, it's been a lot of fun. Mike, thank you so much for being part of the MedEvidence family, and we'll definitely do it again. And good luck on your very important book that's upcoming that we'll speak about as soon as it hits the newsstands or Amazon, as the case may be.
Thank you so much, Mike. I really appreciate it.
Thanks for joining the MedEvidence podcast. To learn more, head over to medevidence.com or subscribe to our podcast on your favorite podcast platform.